prevent this disease progressing because it's an aging disease. And aging is the #1 risk factor. We've actually shot ourselves in the leg. What I mean that we have better health, we live longer, so we get aging diseases. And 400 years ago, 500 years ago, probably nobody suffered from Parkinson's because they died at the age of 30, 40. And as I said, there is a significant financial burden, and of course, in many ways, this disease is even worse than cancer because it's a living death. Not only, of course, what happens to the patient, but the burden it has on the family and the environment. I mean, it's a devastating disease. And what we have to do is try to understand. And of course, I mentioned to you, the numbers have dramatically increased in the United States. It's the same in Israel. I'm sure it will be the same in India, the same in China. Can you imagine what will be the number of Alzheimer patients in the world? And so we need better treatment, future treatment, and we want to stop the disease, the progression, because it's a progressive aging disease. All the drugs that we have today are what we call symptomatic. It treats the symptom and not the disease. I always give the analogy that if you have a toothache, you take an aspirin, it kills the pain. 4 hours later, you have to take another aspirin. So that's the problem. And our idea in the Technion, in our center, is trying to understand the disease and to see whether we can actually develop a drug to stop its progression.